Welcome, and thank you for joining us this afternoon for Northwestern's Robert J. Havey, MD Institute for Global Health webinar, Global Health Education, Training Future Leaders in the U.S. and Abroad. My name is Jen Burke, and I'm a member of Feinberg's Development and Alumni Relations team for the Havey Institute for Global Health. Today's event will begin with a welcome from Dr. Robert J. Havey, followed by a presentation from Drs. Bill Leonard and Ashti Doobay-Persaud with a moderated discussion afterwards. Now, I am pleased to introduce Dr. Robert J. Havey. Dr. Robert Havey is the Deputy Director of the Havey Institute for Global Health, Director and founder of the Global Health Initiative Fund, and Clinical Professor of Medicine at the Feinberg School of Medicine. Dr. Havey is an internal medicine physician at Northwestern, where he is currently the Medical Director for Northwestern Primary and Specialty Care, a Vice President of Primary Care Operations for Northwestern Medical Group, and the Chief Medical Officer of Northwestern's new medical group in Naples, Florida. He is a tireless advocate for global health and for the importance of primary care in all health systems. Northwestern University Feinberg School of Medicine's Havey Institute for Global Health has a mission to expand knowledge and build capacity in global health through transdisciplinary research and education partnerships. Thank you, Dr. Havey.
Yeah, thank you, Jen, and welcome everyone to another of our webinars where we try to showcase a bit of the work going on at the Institute for Global Health. Today we have a great chance to hear from two experts in the field of global health education. When we think about global health, a lot of people think about infectious disease and malaria or low and middle income countries, and we forget there's a massive need for education of both our education in our partner sites and education of our global health leaders. How can you get any of this done if you don't train people in the field of global health itself? And we're really fortunate at the Institute to have two nationally known experts who are passionate about this work and innovative at the same time and have really made an impact on global health education around the world. I'm pleased to introduce our speakers for today. Dr. Ashti Doobay-Persaud is an associate professor of medicine in the departments of medicine and medical education, and she's the co-director of the Center for Global Health Education at the Institute for Global Health. Ashti is the founder and director of the McGaw Global Health Clinical Scholars Program for graduate medical trainees. She's a faculty director for the ongoing Master of Science in Global Health through the School of Professional Studies. She's a global health elective director for a lot of our students who travel, and she's one of the leaders in health and society curriculum for the Northwestern University Feinberg School of Medicine. She's an active member in the Consortium of Universities of Global Health, which is a mouthful, but it's basically a number of universities around the world that have really gotten together and collaborate together on global health issues. She's held leadership positions at that consortium on a lot of the subcommittees, and she's won a prestigious mid-career leadership award. She's an expert and leader in global health, focusing on curriculum development, palliative care in the global setting, and implementation research. Dr. Bill Leonard is the Watkins Family Professor of Global Health and Director of the Program in Global Health Studies, and he's co-director, along with Ashti, of the Center for Global Health Education in the Institute. Dr. Leonard is a biological anthropologist interested in human biology and adaptation to environmental and social stressors. He's done extensive research on aspects of human energy metabolism, nutritional health, and child growth. His work has focused on how populations adapt to their ecological and social circumstances. He's currently the editor-in-chief of the American Journal of Human Biology. And in 2021, he was honored with the Franz Boas Distinguished Achievement Award from the Human Biology Association. Both of these put my resume to shame. I can't believe what they're doing here. So this is really fun for me and exciting at the same time, and I hope it'll be interesting and educational for all the audience. So Ashti and Bill, take it away.
For Havey, thank you very much.
Thanks for the opportunity. Welcome, everyone. We're just going to get our slideshow ready. Perfect. Thank you. Excellent. So as Dr. Havey mentioned, I'm Ashti Doobay-Persaud. I'm here with Dr. Bill Leonard, and we'll be presenting a little bit about the center and what we do in kind of like a short form to give you a sense of our mission, our vision, and a little bit of our project work and our successes. So the title of the talk is Training Future Leaders in the U.S. and Abroad. And that kind of encapsulates our mission and our vision already. So at CGHE, our job really is to train future leaders in the US, pretty specifically at Northwestern, and then abroad to strengthen the global health workforce or education abroad. So keeping in mind that that's sort of like the mission and vision, I wanted to get down to the very sort of concrete strategic goals that we have at the center. And we put these forth right when the center was formed. And you'll kind of hear and learn a little bit about why the center was formed. It's because we have so many educational activities. So some of our strategic goals. The first is to ensure ethical, safe experiences and training in global health, founded on equitable partnerships, grounded in humility and social justice. The second is to establish Northwestern University as a premier institution in academic global health education as a field of research, practice, and scholarship. And just like as a headliner, we really are leaders in this field and have spent a lot of time establishing global health education as an area of academic inquiry. Provide global health programming across the educational continuum to create a pipeline of learners committed to mindful global engagement. I almost edited this one when I looked at it again. It's a mouthful, but what it means is we want to educate learners across all levels, from undergraduate, graduate, health professions, all across the board. So we really want to have an entire spectrum of learners who are dedicated and learn global health in the way that is the best practice. And then finally, and this is where the work has been going, this is the new direction, we've been able to establish and nurture bi-directional, equitable, and sustainable educational partnerships to support the global health workforce. What does that mean? That means we've been able to work with partners at academic medical institutions in different parts of the world, mostly the global south or low and middle income countries. And we've been able to build partnerships to support the building of their workforces in global health. So global health education on kind of an international scale. So as we go through the presentation, I'm going to actually anchor on these goals while I describe a little bit to you about what we do. And then, CGHE, or the Center for Global Health Education, just so everyone kind of gets a sense of where we are compared to our peer institutions. It's a unique institution. It's really, there aren't, if you Google, what centers for global health education exist, there are centers for global health and there are centers for training, but really there isn't another center that focuses on global health and education across the spectrum and then beyond internationally. So really, we are the first center of our kind. And why we were formed is because both at the medical school and at the graduate and undergraduate levels, we've been kind of at the leading edge of educational programming. So a lot of our programs, as you'll hear from Bill and I, started 15 years ago, 20 years ago, 10 years ago. Many schools offer it now, but we were at the forefront of many of these programs. We're also unique in that we work across, I mentioned that we work across our schools, but we also work across professions. We really are interdisciplinary and transdisciplinary. And then finally, sort of because Northwestern has been working in global health for such a long time, all the educational activities we're going to talk about, whatever we do with our students, whatever we do with our faculty, whatever we sort of collaborate and co-design with our partners, they've been rooted in long-term partnerships with universities, global ministries of health, medical facilities, and other organizations. So at Northwestern, we've been in the field for such a long time that we've nurtured very long relationships, and that's been a pretty powerful platform for us to be able to actually implement some of our innovative programs that we've come up with. So training and teaching, right? That is what you do. That is our job at the Center for Global Health Education. So I'm going to talk a little bit about how we train Northwestern health professionals, and then how we train the global healthcare workforce educators. So this really is around the strategic goal of providing global health programming across the educational continuum of learners. So what do I mean by that? Well, I'm at the medical school, and so I'm in charge of providing global health education for our learners at the medical school, for the residency, and then I'll tell you a bit about a master's program. So I'll tell you a little bit now about our programming for Northwestern students and trainees. So we have a medical elective program, global health electives. And as you can see here, we've always been, so the Center for Global Health, which is what the Institute was many years ago in 2009, we have, since that's where you see the first big peak in 2009, we basically started exceeding all the rates for other medical students participating in rotations. The bottom line is the average medical students participating in rotations in global health, and the top line are the Feinberg School of Medicine students. You can't see it because of the writing on the bottom, but as you can see, we were always quite ahead of the curve, and then we all took a dip during COVID, and we're back on our way. And so what we do in the global health elective for the students, they all participate in 4 to 6 week rotations, or not all, they all have the opportunity to do that. It's ethical, safe. We give them a robust pre-departure training program. We have them do safety and security work, and we really abide by this first strategic goal of ensuring safe and ethical experiences for our medical students. So that's the first thing we do at home. And then sort of like, why do we even do all of this? Like, why does every medical student need to learn about global health, or why should medical students learn about global health? Certainly there are the ones that are going to become career global health practitioners like myself and Bill and others. But really, you know, global health education is about training the next generation of students who really, you know, need this kind of exposure to learn about being open-minded, understanding differences, understanding interconnectedness, really being able to appreciate patients or people who come from different cultural backgrounds or different expectations, and to treat patients with humility and empathy. And, you know, we really emphasize that when we are in our educational programming. I mean, students also, like, you know, can learn a lot about different healthcare systems, different approaches to consider, different ways of treating disease. And then they certainly accrue population health knowledge, so caring for immigrant and refugee health patients. You learn that a lot of those clinical skills when you're abroad. And then, you know, this used to be sort of the first reason, and it used to be hard to convince people of it, but no longer, right? So we know that diseases, all these borders are, you know, geopolitical man-made borders, but diseases don't know borders. And you really need to learn about different diseases from different places, both for prevention and preparation for pandemics. And then finally, and sort of what I started with, like, all of these exposures and these programs that we create for students gives them a chance to really learn about global health, how to be good partners, and to learn about different careers that they can pursue in global health. So I told you a little bit about what we do for our medical students. Our residents and fellows also have a program, the McGaw Global Health Clinical Scholars Program. So the program started in 2014, so very early. We're again among sort of the first groups doing very dedicated global health tracks. So we graduated our first group in 2016. We've had 80 graduates, and in this program, we offer global health programming for residents and fellows from across different disciplines. And so we have a lot of surgeons, anesthesiologists. That's what those little colored lines are, or boxes are, just to show you the different disciplines of residents. And I think that while the residents, you know, really enjoy the program for the learning, they also get to learn from each other and learn about each other's disciplines. And, you know, a big part of global health is working together across disciplines. And so I think this is another sort of second special part of the program. And then, so that's for residents and fellows. And in 2016 or 2014, we started. In 2016, we graduated a Master of Science in Global Health. So this is the first online and asynchronous Master of Science in Global Health. So this is before the pandemic. You know, in 2014, we created this course, and we created it to be asynchronous and online, thinking about a global audience. So different students are coming from all over the world. You know, the only way to really make this work is online and asynchronous. And then the other part of it is that really professionals or people who have a lot of skills are the ones that are needed in the field of global health. So different disciplines, different skills. If you want to go into the field of global health, having some education around what is global health can really help a professional launch their career into that field. And that's really what this master's was designed for those professionals looking to launch a career in global health. It's not clinical, but it's there to serve as an introduction to the field of practice and scholarship. So we've had 184 graduates. Our first graduating year was 2016. But if you see that again, it's 2014 when we started, so well ahead of the curve. Now there are many, many online master's programs and also in global health, but we're among the first at the forefront of the field. So I mentioned to you how we do training and teaching with Northwestern healthcare professionals. So now I'm going to talk to you a little bit about the global healthcare workforce educators and how we've been able to establish really thoughtful partnerships that start with education and end up supporting the global health workforce. So here's a little model of kind of how the Center for Global Health Education has done this. So really what this is about is collaborating with international partners. And so how it starts is usually there's a small educational collaboration. There's like a small seed that we plant. It's like a small program in simulation. It's a training program in palliative care, etc. We build a partnership over 1 to 2 years and expand programming. And then we find a place that we can build systems together that will support the global health workforce. And so that line there is a fill in the blank, because I can tell you about different projects we've done that have resulted in systems building in health professions education, systems building in simulation-based medical education, and different areas. But I'll tell you briefly about our palliative care story, where we started with an educational collaboration and ended up working on building a system in palliative care that strengthens the palliative care health workforce in Nigeria. So the project is the Nulu PAL project. So Northwestern University and Lagos University Palliative Care Project. It was through a partnership between our institute and Lagos University Teaching Hospital in Nigeria. So a little bit, I'll tell you a bit about palliative care and a little bit about Nigeria so that we all kind of know what we're talking about. So palliative care is, so I'm a hospital medicine doctor. I'm an internist. I also, palliative care is one of the specialties under our division. So palliative care is specialized medical care for people living with a serious, complex, or terminal illness. And the whole goal of palliative care is to improve quality of life with physical symptom management, mental, and then sort of psychological, spiritual, as well as caregiver support. And it's well known, there are many studies out there that describe that palliative care significantly improves patient quality of life for those facing illness or injury, as well as their family and caregivers. And in fact, the WHO considers it a human right. But there's a really big gap in palliative care globally, and specifically in Nigeria. So globally, only about 1 in 10 patients who needs palliative care gets it. And then somewhere like in Nigeria, Nigeria is a country of 213.4 million people, and they have a huge, their statistic is the same, where 1 in 10 people need palliative care and don't receive it. So it's a critical need in Nigeria. And we've had partners in Nigeria at Lagos for over 2 decades now, working with them from HIV days and onwards. And so we've been working with Nigeria and working with colleagues at Lagos University Teaching Hospital in Nigeria. They just built a brand new cancer center, but they had no palliative care services. And in fact, in Lagos, which is the main city, one of the biggest cities in Nigeria, I think it's the biggest city in Nigeria, it's home to 20 million people. It's the most populous city. And there are no public palliative care services, only private palliative care services. So we were actually approached by a donor who wanted to bring comfort to patients globally. And we designed a program with our colleagues at Luz. It was during the pandemic, but there were a lot of healthcare workers who were providing palliative care, but had no training. And so with colleagues at Northwestern and across Nigeria, we created a 3-part, 3.5-day online training. We delivered it over 1.5 years, and we mentored the trainees, and we were able to establish a good community of palliative care workers, a community of practice at Lagos University Teaching Hospital. And then last year, we did the 4th part of the final part of the training in person in Lagos. And we were able to do sort of like a final overall training there. And in those sessions and throughout all of that work, here's a picture of everyone at the symposium. We have healthcare workers everywhere. But across this work, not only did everyone gain confidence and knowledge, the actual head of the hospital said he wanted a palliative care service built at Luz. And that was built from a seed of us doing these different trainings. And so this is what happened. The 4th year of the grant, a palliative care consult service has been started. It's being piloted, and it's being launched right now. And that happened over 4 years of work that started with a small educational training program. And now here we are 4 years later. And so the partnership doesn't end. Our next step in the partnership is pediatric palliative care. So we learned that that's really what's needed as a next step for everyone there. And so sort of going back to our model of training and teaching, we are hosting a pediatric palliative care symposium this July in an effort to start work on pediatric palliative care through education. So now I will turn it over to training and teaching the next generation through global health studies.
Ashti, thank you so much. Oops. As we've talked about, one of the signature pieces of our Center for Global Health Education is the fact that we train learners across the educational spectrum, from the undergraduate level through medical training, master's, and doctoral training. And really, among the oldest of our global health training here at Northwestern is our undergraduate program in global health studies, which is currently celebrating its 20th anniversary. The origins of our Global Health Studies program really started back in 2000 when my colleague Deborah Greenspan and her International Program Development Office secured a grant from the National Security Exchange Program on international health and medical cultures, the goal of which was to establish interdisciplinary training in global health that would bridge across the Evanston and Chicago campuses. The NCEP grant fostered the development of the courses that eventually went on to become the core of the Global Health Studies program, as well as supporting the creation of signature global health study abroad programs, initially in Mexico, China, and South Africa. And this was a robust College of Arts and Sciences, Weinberg-Feinberg collaboration, supported in part by the then director of the public health program at Feinberg, Dr. Bing Chang. And so when we created these courses initially, they were co-listed as both undergraduate and public health classes. The NCEP grant also supported a series of impactful conferences on HIV/AIDS, health implications of small arms trade, and gender and health in Latin America over the 3 years of the grant. By the end of the grant, by 2004, it was very clear that there was strong interest in an undergraduate curriculum in global health. And so Deborah and I put together a proposal for creating a program and a minor in global health studies that was approved in the spring of 2004, and students began enrolling that fall. The Global Health Studies program was the first Northwestern undergraduate program to require a study abroad or an international experience. As we'd expected, the program grew very, very rapidly. And in 2017, we established an adjunct major being a major that is inherently interdisciplinary, that must be done in collaboration with a discipline-based major. And it's 11-course curriculum. That same year, we also established a joint program with Feinberg and the public health program that we call the Accelerated Public Health Program. It is a 5-year combined bachelor's, master's of public health degree that any Northwestern student can apply into during their junior year. And this has become a very attractive and a very accessible and successful option for many of the undergraduates at Northwestern. Our most recent innovation and development is really creating something that has long been needed in terms of the global health array, and that is the approval of a PhD certificate in global health. So starting this fall, PhD students in any discipline can apply to do a 5-course curriculum that will allow them to get training in global health and receive a certificate. The other thing that has been amazing over the last 20 years is seeing the growth in our faculty and the support that we have from the college for global health studies, going from essentially no faculty or 1 faculty member in 2004 to now having a program of 10 faculty members representing the entire diversity of global health, with training in the social, those of us bringing training in the social sciences, the biomedical sciences, and the humanities, training now ever larger number of students in global health studies. The other piece that remains a strong core for our program is the commitment to study abroad. And here we see some of the core study abroad programs that remain popular in global health. Comparative public health in Serbia and Bosnia-Herzegovina, run by my colleague Peter Locke in the Global Health Studies program. Maternal Health in the 20th Century, a research-oriented study abroad with Sarah Rodriguez, where students are actively involved in researching maternal health in London's Wellcome Archive. As well, we have our longstanding programs in Paris, France, and public health in Europe, really looking at Health in the European Union, and our long-standing program in collaboration with Stellenbosch University, Public Health and Development in South Africa, that happens during the spring quarters. And so building on success, over our 20 years, the Global Health Studies program has been recognized with numerous national awards, including the Senator Paul Simon Spotlight Award for Campus Internationalization in 2013, and in 2018, the High School Award for Innovation in Global Education. To date, we've graduated over 1,200 alumni now in Global Health Studies, with about 40% of them pursuing careers in the health sciences, medicine, and public health, but also many others pursuing careers in business, law, and higher education. Our students, many of whom right after graduating, before pursuing advanced degrees, go on to hold prestigious fellowships such as Fulbright, Princeton in Africa and Latin America, and Global Health Educators. And as we can see from this slide, the popularity of global health studies continues to grow. Since 2016, the number of students who are taking global health studies classes has more than doubled, from 500 to over 1,100 this last year. And similarly, the number of majors and minors that we have in global health studies has increased by 60% since 2018. Global Health Studies is now the 4th largest major in the College of Arts and Sciences. This year, we'll be graduating over 100 students. And so what you can see is that our Center for Global Health Education is now regarded as one of the premier centers of its kind. Ashti and I and our colleagues are inspired to work with and train the next generation of leaders who are committed to addressing global health disparities and improving the quality of people's lives around the world. The growth and success of the center would not have been possible without the strong commitment from the university and our individual colleges, as well as the generous and visionary support of alumni and donors, and as well the tremendous passion of the students that we're working with. We look forward to the center's continued growth and success for many years to come. Thank you very much.
That was great. Thanks, Bill and Ashti. The audience has sent in a couple of questions. I just thought I'd throw it at the two of you, and I'll pick on each of you separately, so don't take that personal.
All right.
But first, I think it's going to be nice if you can kind of in a short period of time, 60 seconds or so, each of you tell the audience, why you got attracted to global health education to begin with, just so you kind of understand your journey and what led you there. Ashti can go first since nobody's speaking.
Okay.
Ashti, you go first.
Mine is sort of very cliche, and we have a podcast a little bit about me, but I have always wanted to do global health work. I wanted to be in Doctors Without Borders when I was 11, and then learned that a lot of the ways that you can help or that you can support and do good, strong, ethical work is through education and teaching people to do global health work in thoughtful and sustainable ways. And then I love medical education and I love teaching young learners. And so my area of growth, partnership-wise in global health, has been growing global health education with partners. So
Great.
That's my answer.
Thank you. Bill?
Yeah, and I would say my story is similar. I mean, I have long had an interest and a passion for understanding and promoting health in lower resource populations around the world. And when Deborah Greenspan, now 24 years ago, came to me and said, well, there's this grant opportunity to potentially create training and a curriculum around what we then called international health that would bridge both arts and sciences, engineering, as well as the medical school, I said, let's go for it. And it has been a remarkable journey ever since.
Great. Well, thank you. Ashti, why do you think there's been so much interest on the part of our medical students? I mean, just for the audience to know, it's actually a known fact in the admissions office of the med school that one of the things that sets Northwestern apart is the Global Health Institute and the opportunity to do these global health rotations. And they're incredibly popular with the students. And, just to remind all of us, when we say something's popular, it's not like it's a picnic. These are pretty grueling 4-week rotations these students take. They're not luxurious. They stay in hostels or sometimes host families' homes. They don't eat a lot. Their budgets are small. We basically pay for the travel, but they volunteer for it. They're lined up volunteering for it because of your guys' program. They're well prepared when they show up. But Ashley, why do you think there's this interest in global health rotations by medical students to begin with?
Sure. Well, I think there are a couple of things. So I think the first is a little bit speaks to why I do global health. So it's like the profession of helping, right? So everyone who is sort of signed up to go to medical school, they want to contribute, and they want to contribute globally, because this is like this sort of like romantic notion of improving health, worldwide. And, they're big dreamers, and they want to help, and they want to have the biggest impact. And then there's also sort of a long history, right, of like of trying to improve health clinically for doctors, and we know that story, and we have like the Paul Farmers to sort of look up to, and there are these figures. But I think more than anything, it's the same group of people, like the group of people who are helpers and want to like contribute and serve. And so not only are they helpers, but they're also really smart. And so they can see, I think, that the opportunities we've created are ethical and sustainable, because, we're always combating against volunteerism. And so I think the smart, young, excited students can sort of see the value in the rotations that we offer.
And just for the audience, this voluntary or voluntourism is something we've always been against. I mean, the Institute's really prided itself on kind of our capacity building, our sustainability objectives. We don't want to drop in and drop out of anywhere. We don't want a student just showing up so that they can send some photos around. We wanted to transform them, and we wanted to impact the populations that they visit at the same time. We want it to be a win-win. And it has been popular. I think it's a great thing for the medical profession, because there's a lot of jaundice in the world. There's a lot of cynicism. There's a lot of kind of worry from the public about how corporate medicine has become, how hard it is to navigate through a medical system. And yet it's going to start with the providers and start with the clinicians, and they have to be inspired and reminded why they went into medicine in the first place, because it is a lot of work. I'll say that for myself. What we do is a lot of work, and people come into this, as Ashti mentioned, for the right reasons, and these rotations just inspire them further. And it's a great sign that they're doing this not for the money and not for prestige, but just for the good of doing it. So thank you for that answer. And Bill, I'm going to turn to you next, because you did talk in your great comments about the long trajectory of how long you've been involved with this, going back almost 25 years. I think the audience might think, well, all the universities do this. I mean, what's a big deal? Everybody does a course here and there and this and that. I mean, what sets us apart? Why are we different?
Yeah. Thanks, Bob. What sets us apart is we were really among the first to wade into this in an integrated approach. I mean, you'll see global health and international health at many universities, in a medical school, in a school of public health. What Northwestern has done over the better part of the last 25 years is make global health a university-wide, Northwestern-wide initiative with collaboration across Feinberg, the College of Arts and Sciences, Weinberg, McCormick Engineering, bringing together diverse perspectives and both diverse learners and experts in a collaborative fashion to address these long-standing problems of global health. And I think what we recognize now is that these big long-term problems in health disparities that we see around the world are not going to be solved by a magic bullet from one discipline. It's going to be collaborators with different expertise rolling up their sleeves and coming together in a collaborative fashion that are going to solve these long-term problems. And that's one of the things that is really so inspiring for me, working with these young students from different backgrounds, coming together, trying to address these long-standing problems in a new, ethical, and hopefully sustainable fashion.
Thanks for that, Bill. You know, I had a meeting earlier today with one of our other global health centers, and the comment was made because a lot of our low and middle income countries are challenged. Not only are they impoverished in many ways, which is why they are called low and middle income. They're pretty low per capita income rates, but they're kind of messed up and challenged politically. They have governments that come and go. They have coups. They have violence, and yet everyone commented when I talk about this with all our centers that the one thing that seems to remain in all these countries, no matter how bad things get, are the educational institutions, the partner institutions of ours, the universities. So they don't fall. I mean, they're there, and thank goodness for that. But at least there's one little glimmer of hope when those countries get challenged, that there's hope for the population, because there's still these educational institutions. They need strong partnerships from experts like us, and that's one of the things we're committed to. Is we look at those partners as a two-way street. We learn from them, they learn from us, but we support each other. But we, from the Institute's point, since we are a better resource, we really take that seriously to try to support them, because we know that's the infrastructure that is the underpinnings of even a civil society in these places. Otherwise, everything falls apart. So Ashti, along those lines, since we talked about those comments being made earlier today when I was meeting with still another center in the Institute, maybe you can tell us a little bit about how you partnered with other centers within the Institute. We have 10 centers, and you've done work not just in your own. I just would love everyone to kind of appreciate how you cross those lines and you figure out programs to involve not just the education center, which you and Bill run, but other centers. Can you give us some examples of that?
Sure, yeah. So we've had a couple of different cross collaborations. One with the Center for Global Oncology through the Palliative Care Grant. And so a lot of the Palliative Care Grant was built upon relationships through the Center for Global Oncology. And so the Center for Global Oncology does a lot of high-level research, genetic level research, but it's a holistic process, right? So like identifying the cancer variant, identifying chemotherapy, but then providing care along the spectrum was there. And so that is actually how we were introduced and connected to the group that is now the Palliative Care Consult Service. At the time, it was one consultant who was working with our head of oncology. And then for primary care, we actually cross over a lot because I'm an internist. And so a lot of the electives that our internal medicine residents do, they work in primary care settings. And so we've crossed over with primary care when we were working through some of the project awards in primary care. And so those are at sites that our students go to. So what that means is it's a care delivery site, a primary care delivery site, and our students go there to do clinical care delivery. But on the educational end, they're sometimes delivering curricula, and they're working with our center to create the curricula or deliver the curricula. So they did like an ultrasound curriculum for diagnosing pneumonia. So they trained the center staff how to use a low resource, kind of item to diagnose pneumonia. And then they would take a picture, and that picture gets sent to like all of my friends here at Northwestern who are it's on a private screen, and they can help with reading the ultrasound images on a sort of live chat, WhatsApp chat. So that's an example of both collaborating across centers, but then also involving faculty and clinicians at Northwestern in all these different projects.
Great, thanks. Bill, maybe you can let us know a little bit about where what countries your center is involved in now, and then, really what our ambitions are, where we want to expand, which continents, which countries. Maybe you can give us a little quick thumb sketch of that.
Certainly. Yeah, no, I mean, our center has work throughout Africa, as well as in parts of Latin America, in Bolivia, Ecuador, as well as parts of Asia. And I think the goal of our center is to be fully global. And I think here is where, as Ashti was just talking about, continuing to foster the partnerships with the other centers within the Institute becomes critically important. And helping to develop sort of targeted curricula and educational training opportunities that are relevant for both the particular specialties that we're talking about, as well as culturally attuned to the context within which care is being delivered and the work is being done. Working ethically and sustainably to try to develop culturally appropriate interventions that are going to be sustainable and effective over the long term.
Perfect, thank you. Ashti, put your binoculars on. Look out 5 years, 10 years.
Boy.
You're gonna be, more active. You're gonna accomplish more things. But where do you want to see your center in 5 and 10 years? Let's say 10 years. What would you like to be able to tell this audience if you came back in 10 years? What are you doing now or then that you're not doing now? And just kind of paint that picture for us.
Sure. Well, I think we've got a couple of sort of interesting areas of growth. Short term, like 3 to 5 years, I think we can develop, I'd love to develop global health fellowships for faculty. So sort of like, if you've seen the course of our work, Bill started undergraduate studies, 15 years before anyone. We started all of our programming about 10 years before anyone. I think the time is right to develop these clinical global health fellowships for faculty in a more thoughtful way. And I think that's sort of my next sort of training step. So that's sort of small. That's not like, not too far binoculars. But then I think on the bigger scale, we could start really harnessing virtual reality and having project and partnership development and educational development happen virtually on over a year or something together, really develop relationships. Because at the end of the day, all the work that I do that starts as a small program builds into a system delivery because of a good relationship and partnership. And that's a lot of what we teach. And so I think we can teach our students a little bit of that, maybe using technology. And then I think the last thing, and this is just sort of a big dream, and I'm starting regionally here, so I've been working a lot with colleagues in, what is commonly called Sub-Saharan Africa, to build a consortium of faculty, like health professions faculty, so doctors, nurses, who care and want to teach the next generation how to do that really well. And so I hope that we catalyze a consortium, and I think we're at the forefront of that, and then we support that in some way or form, because I think investing money in that invests money in the workforce, and that's the future. The future solutions are not me. They're the future doctors, nurses, and pharmacists across, Sub-Saharan Africa and everywhere else. So that's what I can come up with.
Okay. And Bill, just so we're running out of time, so we'll only go through maybe one more, and that is, we've been lucky at the Institute to have incredible, generous philanthropic support. A lot of the people watching right now have really been the reason we built, the reason we're doing what we're doing. Maybe you can tell us from your perspective. You've been here a long time and you've seen how the Institute's grown. What's that philanthropic support allowed you to do and allowed your center to achieve?
without the philanthropic support, we would not be nearly where we are with either the center or the undergraduate program. It has allowed us to grow in ways in terms of providing support for students and faculty to do the kind of work that they want to do. The undergraduate level, it has been critically important. We hear time and time again from our students at the undergraduate level, as well as the master's and in terms of their MD training, how transformative these international experiences are. And so much of that is being supported by philanthropy, by the tremendous generosity of our donors. And, you know, the fact that we're able to be the global health presence that we are in the medical school and at the undergraduate level, and train students in the way that we're able to, is really a reflection of the tremendous generosity of our donors. And it's a tribute to their vision
Right.
and their thoughtful input.
Well, thanks, Bill and Ashti, and thanks to the audience for watching. You know, as a closing comment, I just want to remind everybody, it's very hard many days to describe what we do because there's no easy fix. There's still 8 billion people in the world. That's an enormous number of people. That's going to grow to 10 billion in the next 30 years. That's a massive number of people to handle if we were middle and upper income and had resources. And yet if half the world doesn't have any decent resources, living on $1,000 a year, how do they have any way to have even a decent life, decent health, decent ability to work and take care of their own families and communities? It's a mess all the way around if we don't keep at some sort of structured way of approaching the problem. And we couldn't do this global health work by just marching in and taking care of malaria or trying to cure polio or take care of stroke in hypertensive areas where they don't have good care. We need to train leaders. We need to raise awareness. We've got to let people understand this. And just, you know, societally, this has been a pitch of mine forever. I've always said the social stability of the world depends on good health worldwide, and it does, because I love Bill Gates's saying that when anyone anywhere is desperate, everyone everywhere is at risk, and that is true. I mean, you know, we have an obligation to share the kind of benefits that we have growing up in the U.S. Sometimes it's an accident where you're born and what you have, and we can't take that for granted. And we want to train everybody. And when people think of the Institute as something that's just been a medical student thing, I want to remind everybody, you've got to go across the university. You've got to educate young people as young as you can get them about the entire world, not a little snapshot, not something that comes in on Instagram, not something that comes in on social media or on the nightly news, but really what's happening. I mean, study the whole world because it's smaller and smaller. It's going to shrink even more. And we need educated people who can thoughtfully look at all the intricacies of why things are messed up, why some stuff works, why some stuff doesn't. And that starts with education. So we wanted to profile our education center today on this webinar. I hope you've gotten a grasp of why it's so integral to the whole purpose of the Institute, that without this center kind of training people, preparing our students. I mean, Ashti does this incredible job of getting the students before they leave, getting them after they come back. Bill prepares these undergraduates. Together, they create these programs. This doesn't just happen. It's like a lot of things in life and in the world. You need a couple of champions. These two are the champions to create something, to have the passion and just put it together. Otherwise, what happens? Nobody's trained. People just kind of show up, and even if we sent them for travel, what do they do when they get there? They're not prepped. So there's a lot of work that goes in that hasn't been touched on during this 1 hour, but I hope you got a flavor for it. And on behalf of the Institute and all of our members and Ashti and Bill themselves, I really appreciate you tuning in, and even more so, I'm very grateful for all the support you've given to the Institute. So have a great day. And if you have other questions that we didn't cover, send an email out and we'll try to get back to you with some answers. Take care. Have a great day. Bye-bye.
Thank you.
Thank you.
Jen, do you have a wrap up?
Thank you, everyone, for joining us. And thank you, Dr. Doobay-Persaud and Dr. Leonard and Dr. Havey for speaking with us. If any of our attendees are interested in learning more about the Havey Institute for Global Health or supporting our work, you can visit us at globalhealth.northwestern.edu. We will be sharing a recording of this afternoon's event by email, so you can keep an eye out for that. And again, thank you so much for joining us, and we look forward to seeing you again soon.